Hi everyone, welcome to Point Categories presented by Lamp AccuWellness Foundation, Inc. Featuring the Luo-Connecting collateral points, ways of using Luo points. The use of the connecting points by themselves is based on the full or empty symptomatology of each connecting channel. The full and empty symptoms of the connecting channels are described in Chapter 10 of the Spiritual Axis. The indications of the connecting points according to the full and empty symptoms from Chapter 10 of the Spiritual Axis do not have the same clinical relevance for all points. The indications with greater clinical significance are as follows. Stomach 40, insanity, full. Spleen 4, abdominal pain, full. Abdominal distension when empty. Heart 5, aphasia, empty. Kidney 4, backache, empty. Pericardium 6, chest pain, full. Liver 5, genitalia problems, full. Itching genitals, empty. Stomach 40, abundant splendor, abundant prosperity, rich and prosperous. Quiet word point. This wonderful nurturing point connects and enhances the official who rots and ripens to the one that transports and transforms, thus bringing balance and harmony to the earth element. It is one of the main points in TCM to resolve and clear damp and phlegm from the system, and thus can help with mental fogginess and confusion, lethargy, poor memory, worry, or obsessive thinking. Luo connecting point of the stomach meridian transforms phlegm and dampness, stops cough and wheezing, calms the shen and clears phlegm from the heart, activates the meridian and stops pain. Stomach 40 is known as the phlegm point. It helps resolve phlegm throughout the body. Spleen 4, princess, grandson, supreme grandchild, yellow emperor, ancestor and descendant, grandfather and grandson. Opening point of Chong Mai, coupled point of Yin Wei Mai. One of the most beautiful and powerful points in the body. Consider where a patient has long-standing lethargy and weakness, self-pity, has a weak digestion, is anxious or depressed. Helps in cases of excessive bleeding, especially for painful, irregular periods. Spleen holds the blood together. Fibroids or swelling of the abdomen. This point's name has the connotation of continuity through the generations and is the family name of the yellow earth emperor, Kung Sun. It connects to Chong Mai and thus to pre and post heavenly chi. The meridian passes through the 3 jiao before entering the uterus, thereby regulating menstruation. Spleen 4 helps circulation in the legs and, as the Luo connecting point, promotes balance and equilibrium within the earth element. Spleen 4 is Luo connecting point of the spleen meridian, master point of the Chong Mai vessel, coupled with pericardium 6. Spleen 4 strengthens the spleen, harmonizes the middle jiao, resolves dampness, regulates the Chong Mai, regulates menstruation. Heart 5, penetrating inside, communication with the interior. A Madanyong heavenly star point, audacity point. Heart 5 enables a deeper connection to be made with the patient. Being the Luo connecting point, it communicates with small intestine. In doing so, it harmonizes these two officials and brings in the discriminatory influence of the small intestine to maintain the heart's virtue and thus the mandate of heaven. Heart 5 connects to the tongue and eye. For stuttering and speech disorders, palpitations, neuralgia, or spasm of the arm. Helps to see further beyond the mask. Enables the patient to be more in touch with their real self. A peaceful point that gives strength and stability to a person shocked or traumatized. Heart 5 aids clear thinking and communication. Helps maintain emotional harmony. Luo-Connecting point of the heart meridian. Calms the shen, benefits the tongue, regulates heartbeat. Heart 5 is a very good point to tonify heart chi. Kidney 4, great bell, big bell clock, great cup. This point can have a powerful effect on calming a person's emotions, particularly fear or for a lack of self-confidence. This can often be as a result of working too relentlessly, forcing their will to overcome great obstacles in life, and thus depleting their reserves, their jing. It helps to balance, stabilize, and harmonize the water officials. Kidney 4 strengthens the back, stores our reserves of energy, often tender upon palpation if unbalanced. Luo-Connecting point of the kidney meridian benefits the kidneys, local point for heel, ankle pain, strengthens the will. Pericardium 6, inner frontier gate, inner pass. Opening point of Yin Wei Mai, coupled point of Chong Mai. General junction point, one of the 9 needles for returning yang. Perfect love point, broken heart gate, gate to success, conserver of yin. Local point for travel sickness, morning sickness, or chemotherapy-induced nausea. Pericardium connects to the inner aspect of a person, triple burner to the outer. This potent point restores harmony and balance between the triple burner and pericardium and is often used with triple burner 5, outer frontier gate. Particularly useful in cases of anxiety, sadness, or lack of joy, perhaps as a result of relationship conflicts. Consider pericardium 6 for stomach disorders, especially nausea and morning sickness, which may start 5 or 6 weeks into pregnancy, but is often gone by the 14th week. For irregular or painful menstruation, insomnia, tightness in the chest, heavy-heartedness, or palpitations. The pericardium and triple burner meet in the chest. The Quan in its name, Nei Quan, indicates the importance of this gate. Luo-Connecting point of the pericardium meridian, master point of the Yin Wei vessel, coupled with spleen 4. Pericardium 6 opens the chest, regulates heart chi, calms the shen, harmonizes the stomach, relieves nausea and vomiting, regulates chi. Pericardium 6 is an extremely popular and useful point. It is very helpful in treating insomnia and calming the shen. It also is the point to use for nausea and vomiting. Furthermore, it can be used for any condition related to the chest. Liver 5, insect ditch or insect gate, wormwood canal. Master of blood or menstrual point. This point brings the wood officials together, restoring their stability, unity, and harmony, and can be helpful for depression, a common liver-related condition. Consider liver 5 for a feeling of insects crawling on the skin or dreams of things crawling. This point clears the ditch. Liver 5 connects to the genitals and can help in cases of sexual problems such as premature ejaculation, sterility, or genital itching. Consider for menstrual problems. Helpful if there is difficulty flexing the knee or for throat restrictions due to emotional problems. The deep pathway flows through here. Luo-Connecting point of the liver meridian regulates liver qi, resolves damp heat in lower jiao, benefits the genitals. Use of the connecting points according to their energetic influence. This is probably the most important use of the connecting channels and points. Each channel has a connecting area that is like a network of small channels in the superficial part of the body, between the main channels and the skin along the pathway of the whole channel. The pathology of this area, and therefore of the collecting channels, consists primarily of invasions of external pathogenic factors causing tendinomuscular problems. Therefore, the connecting points are extremely important to affect the superficial areas of the channels and particularly the joints, sinews, muscles, and skin in tendinomuscular problems. For example, in case of tendinitis of the elbow along the large intestine channel, the connecting point Li6 will affect the connecting channel area, the sinews and muscles situated between the main channels and the skin, which is where the pathology of tendinitis is situated. When they are used for channel problems, the Luo connecting points are sometimes chosen on the opposite side to where the problem is, on the same channel in acute cases, and on the interiorly-exteriorly related channel. For example, if there is an acute pain in the right shoulder along the large intestine channel and some local points on the large intestine are used on the right side, Li6 can be added on the left side to reinforce the treatment. In a chronic case, lung 7 would be used on the left side. The connecting channels, and therefore points, are not used only for superficial tendinomuscular problems. As discussed, the connecting channels occupy the area between the main channels and the skin. They are horizontal, forming a network of small channels, and they cannot penetrate through the large joints as the main channels do. This means that the connecting channels in this area are very prone to stagnation of qi and stasis of blood. Indeed, it could be said that most stagnation symptoms in the body occur in the connecting channels area. For example, breast distension from qi stagnation in women occurs in the connecting channels area of the breast. A myoma, fibroid, in the uterus is due to blood stasis in the blood connecting channels of the uterus. A feeling of lump in the throat is due to qi stagnation in the connecting channels of the throat, and so on. Therefore, the connecting points have a very important use in moving qi and blood in the channels when these are affected by qi stagnation or blood stasis. The spiritual axis also says in chapter 10 that when the connecting channels are full, they can be seen. When they are empty, they cannot be seen. This is due to the fact that the connecting channels are more superficial than the main channels and branch out into the smaller branches of the superficial and minute channels. In full patterns, the connecting channels and their smaller branches are congested and can therefore be seen. A greenish coloration suggests stagnation in these channels. A bluish color indicates cold. A reddish coloration suggests heat, and a purple color indicates blood stasis. The channel pathway areas should also be palpated, and they can feel cold or hot to the touch. This, together with the coloration, indicates retention of cold or heat in the connecting channels and their branches. That is an excess condition. In deficiency patterns, the connecting channels and their branches are void of qi, so nothing can be observed outwardly in terms of color. But in chronic severe cases, a flaccidity of the muscles can be observed. In excess conditions of the connecting channels, the connecting point must be reduced, and in deficiency conditions, it must be reinforced. In case of venule and capillary congestion manifesting with macules on a connecting channel, these blood vessels can be pricked and bled. Use of the connecting points according to their energetic influence. Use of the connecting points to affect the superficial areas of a channel in tendinomuscular problems. Use of the connecting points to eliminate stagnation of qi and or blood in the connecting channels areas. Use of the connecting points to drain or tonify the superficial connecting channels according to manifestations on the skin. Connecting points are also often used in practice according to their specific action, irrespective of their being connecting points. For example, stomach 40 is very much used to resolve phlegm, irrespective of it being the connecting point of the stomach channel. Triple burner 5 is often used to expel wind heat. Pericardium 6 is very much used for chest problems and emotional problems. Lung 7 can be used to affect the head. To summarize, there are 6 ways of using connecting points. In conjunction with the source point of the primarily affected channel to reinforce its action. According to the full empty symptomatology from Chapter 10 of the Spiritual Axis. According to the range of action in terms of energetic layers. That is, to affect the superficial layers in channel problems. For stagnation of qi and stasis of blood in the connecting channels areas. To drain or tonify the connecting channels according to manifestations on the skin and according to their specific action, irrespective of their being connecting points. Thank you very much for your attention.